This segment sponsored by the Springfield Clinic.
For this week's Wellness Wednesday, we have Dr. Nathan Joes here with Springfield Clinic to discuss sleep apnea. I know this is something a lot of people deal with. Doctor, good morning to you.
Good morning. Thanks for having me.
Yes, of course. Glad you're here with us on this Wellness Wednesday. So what is Inspire Sleep Apnea Innovation? Let's talk about that.
You know, it's a development that's really been growing in the market over the last 4 or 5 years as an alternative to the common CPAP or BiPAP therapy that's been the mainstay of treatment for sleep apnea for many years. And some folks have just struggled with those therapies and had a lack of other options that Inspire's really come to the market to try to fulfill.
Now, how does it work exactly? Is there an insertion process, a procedure? What happens?
Yeah, it is a surgical procedure to begin, and we start in the office with an evaluation to see if someone's sleep apnea is of the right severity, if their body type is of the right style, or how things collapse or snore, that the Inspire system would be a correct option to try to fix those issues. And then that leads to a surgical procedure that is an outpatient surgery. It takes a couple of hours to perform. To implant this stimulation device to try to open up the muscles of the throat to maintain an open space while folks are sleeping instead of snoring and collapsing as they do with sleep apnea.
What's the maintenance process like? Is it long-term upkeep? Do you constantly have to come back to the doctor? What's that look like?
You know, after the surgery, there's one follow-up from a surgical perspective to make sure everything has gone okay. And so we see folks back 7 to 10 days after a procedure. And then their pulmonologist, who typically manages the sleep apnea long-term, has a more thorough follow-up from there to activate the device a couple of weeks after surgery, typically 3 or 4. And after that, to titrate the device to make sure that it's working as well as it can work without ever having any discomfort. So they'll have a longer relationship to follow up that device every few months initially, and then maybe annually after that.
Okay, and I know you say you do an evaluation with a patient beforehand. So what type of patient are you looking for that would benefit from this procedure the most?
Yeah, we see patients of all ages with sleep apnea, anywhere from 18-year-olds all the way into the 70s and 80s. And those folks that have come to us are typically referred over through their primary care doctor or their pulmonologist who has been managing that CPAP device or BiPAP device. So patients will have had a sleep study to be diagnosed in the first place, and we're looking for sort of a moderate to severe level of sleep apnea. And those patients have also been through a trial of CPAP, which is the gold standard for sleep apnea therapy. But unfortunately, just not everyone gets along with that. Rates for between 50% success and maybe 80% success are seen across the United States. And while the Springfield Clinic is on the upper end of that, those patients that fail just don't have a lot of other options. And so we turn towards surgical options to see what might work for them. So age isn't really a requirement. We see age groups of 20 all the way up to the 70s that have had these implanted, but more about the severity of their sleep apnea and that they've tried and failed everything short of surgery.
And doctor, really quick before we let you go, if someone is watching this right now and they're interested, how do they go about getting a consultation?
Sure, they can always feel free to reach out to our office at the Springfield Clinic. I have offices in the main campus in Springfield and in Jacksonville, and our number there to reach us is 217-528-7541. And of course, they can always ask through their pulmonologist or their primary care physician, who we're always happy to reach out and discuss with, even off the cuff, just to kind of give them some direction on who might be a good candidate to talk with.
Okay, perfect. Thank you so much. A lot of great information on this Wellness Wednesday.
Yes, thanks for having me. I appreciate talking to you.
Of course.